I appreciate the opportunity to be here and talk a little bit about my organization, Class, and what we do. Before I begin, I want to tell you a quick story. This was World of Health IT was a conference that was held here in Dublin in May of 2014. Does anybody recognize this picture? Anybody tell where this is? Okay, so if you grew up in the 80s in the United States, which I did, when I was in junior high school, there was a band called U2, which came out with an album called Joshua Tree, which for me, in my generation, was probably the greatest album I've ever heard. And so it was my first time I came to this country. I got an opportunity near the convention center downtown to go to Windmill Lane Studios where that album was recorded. I just found out as I returned now years later, it's been torn down. But what an amazing place. And so when I show this picture of me in front of that building to my friends back home, they were very impressed. So you guys have amazing musical heritage here, as we just saw, and then also in more modern times. So it's a privilege to be here. I wanted to just walk through really quick and talk to you about Class, my organization. We're an organization in the United States. We've been around for 20 years. How many of you are familiar with Class? By raise of hands. Heard some of the reports, perhaps? So our organization, our mission is to improve the world's healthcare by providing transparency to every major healthcare technology and services decision. And I love this quote: when performance is measured, performance improves. When performance is measured and reported, the rate of improvement accelerates. And so at Class, essentially what we do is we go out and interview healthcare providers, not only in the United States, but around the world, on the performance of their vendor, their supplier in technology. And we take that data and we share that back to the participants for free. So if you as an IT professional or a clinician in a hospital or health system give us your perspective on how your supplier is performing, we will share that back with you. And we've been doing this since 1996 in the United States. We currently are speaking with 2,500 providers around the world, and we're getting lots of performance data on how electronic patient record solutions are performing, how those vendors are performing, and then we share that back. This will give you kind of a perspective of what those numbers look like. We've actually been in, it was about 7 years ago with the breakup of NPFit in England, we noticed that a lot of our performance data was being looked at online by folks in this part of the world. And we thought, what's going on? And we found about the National Program for Health IT, and we came over here and we found out that no longer was it Cerner or iSoft as a solution in England. It kind of opened up the market where those trusts could look at other solutions. And that's when we started measuring the performance of those suppliers here in this part of the world. And since that time, we've expanded now around the world: Middle East, South America, Asia, Australia, different countries where we're measuring what's going on. This is our Class International Advisory Board. A couple of individuals on our board are here with us this week. It's been great to hear from Richard yesterday. Our good friend Rachel is here with us as well. And these are individuals that help us understand where we should measure technology. I thought it would be helpful today to take a few minutes and just share with you. I personally speak with about 150 healthcare providers around the world every year. And these are good friends of mine that I reach out to. In the course of those conversations, these are all typically done via telephone. I will ask them to give me a numeric assessment of their particular vendor. I ask about things like support and maintenance and the contracting experience, and if they keep promises. And I take all of that data. I also gather anecdotal comments. I keep the conversation anonymous, but I'll take all that data along with my other researcher peers and aggregate that into a lot of data that we're gathering. As I'm having these conversations, I thought it'd be interesting to share with you, these are some of the topics that we're hearing that predominantly in the U.S. And as I've been able to participate today and yesterday, it's amazing how many of these things are real issues in this part of the world. So things like shift from fee-for-service to value-based care, that's one of the things we're facing in the United States right now, is not just treating sick patients, but keeping sick patients out of the hospital, like was referred to for the gentleman in Australia. How do you keep patients healthier by way of diet and exercise and some of the decisions they're making? EMR usability. You probably have watched in the press how much money is being spent in the United States on technology. You've probably seen our outcomes for how much we spend, so we've got some work we need to do. I know that's a very real thing that is being considered here in Ireland as well. What's the go-forward electronic patient record solution for this country? And so those are certainly things that are going to be looked at, is how usable are those solutions. Cybersecurity, major event, heard all over the world. We heard all about that, some of the difficulties being faced just this last week. Population health management, genomics, clinical decision support. In fact, I wanted to show you this. Yesterday we had some good discussion around telemedicine. And this could very well have been a picture of me in the 1980s. How many of you recognize some of the devices in this picture? Right? Do you remember those camcorders? My parents had one with a light on it. It was like I was a TV reporter every time they filmed me, right? Word processors before the IBM PC came out in the early 1980s, right? We had one of those in my home. That's how I did my papers in school. Lots of these devices now fit in your pocket and come for free on this incredibly powerful device. So what are we doing in healthcare to use these devices to get patients engaged in their own care? Huge topic right now in terms of telemedicine and how that works. Virtual consults, things of that nature. This is a fun clip I wanted to show you. In 2003, I helped author at Class, my organization, some of the first studies that we did on computerized physician order entry. This is when, in the United States, less than 1% of hospitals had physicians even entering their own orders. And so we would go out and validate where that was actually happening, who their EMR was it Cerner, Epic, Meditech, Siemens at the time, McKesson, some of these other vendors that you're probably familiar with. And I remember in doing this research, one of the things that kept coming up was alert fatigue. Well, we got all these contraindicational words, drug allergy. We turned them all on, and our nurses hate them. They don't even pay attention, and there's too many of them. And shortly after doing that research, I saw this clip. I wanted to play it for you. So you need to tell your nurses if they ignore the alerts, these kinds of things happen. Very serious. So how do you turn on alerts? How do you use technology to help you be a better clinician? There's a science in how that's done, and we've been able to study this over the last several years. We talked about this a little bit earlier today, and I really appreciate the remarks from the gentleman from Australia. This is a quote from a provider I spoke who said, "Today I'm practicing sick care, not health care. We should be focused on keeping patients healthy, not just treating them when they're sick." So how do you shift from just treating patients to actually keeping them out of your organization? You have incentive-based contracts to do so. And this is a very difficult thing to do if, in fact, you're incentivized to treat patients and you're starting to take on these at-risk contracts at the same time. How do you balance that? It's very difficult to do. And it's a big reality in the United States right now. And here as well. Getting paid when your customers exercise. We talked a little bit about this as well. How much can a vendor really do to drive success for providers when providers are struggling to drive success for patients? I was speaking with a surgeon friend of mine. He said, "Jason, it's actually easier for me sometimes," he said, "to crack open a patient's chest than it is to get them to eat appropriately and exercise." So how do you get a patient involved in their care? Well, some of the things that we've seen earlier is you actually have to make them a steward in their care. Show them what they look like. Give them tools so they can actually see what happens if they don't. So patient-centric care and this concept of getting the patient engaged in their care using tools. Another fun thing we're watching. So at Class, we will go out and interview these providers, much like yourselves, and we'll take this data, aggregate it, and we put it into tools online. So if you were going to go consider which electronic patient record solution you should go with, what typically happens? Well, in our experience, we found that individuals will often call up their friends and say, "Hey, you have this particular EMR solution. What has your experience been?" And essentially what we'll do is we'll take that perspective, 10x, 50x, 100x, and put that into tools like you'll see here. So client commentary, we'll keep the individuals that we talk to anonymous, we aggregate this data, and it's out for public consumption if the individual will take the time to speak with us. That's the symbiotic relationship we've set up. I know that here in Ireland, for example, we heard yesterday about the maternity solution that's live now with Cerner. So how is that performing? Well, how does that solution perform compared to the Philips solution, or the GE solution, or Epic solution, or some of these other vendors that you've heard of? Well, we'll go out and aggregate that data and put it in the database so that it can be seen. What about client comments, verbatim client comments in the bottom right? We'll actually gather those as well. We'll also go out and do specific reports. Here's just an example. The global EMR market share. So who can answer the question around who has sold contracts of these EMR vendors around the world? Well, we've actually gone out and done year after year assessments of who's selling what. So if you look at the InterSystems TrackCare product, where is it live? How many contracts did they sell last year? And class, our organization, will actually go out and validate that. How does that compare to a Cerner or to an Epic? Or even to regional solutions like a ChipSoft? And we'll go out and do that assessment. We've also done assessments around, once these solutions are selected, how deeply implemented are they? So how involved are the physicians? Are they entering their own orders in those regions around the world? Are they doing their own documentation, or is it just a light implementation that is scaled over time? And what does that look like by vendor and by region? So we've got comprehensive data on that as well. What about things like business intelligence, analytics? And how does that compare region to region, vendor by vendor around the world? Very interesting to see how that's rolling out. What about global PACS? PACS seems to be a solution that's fairly ubiquitous across regions, a lot of the same vendors. So what does that implementation look like, and how is that different or similar around the world? Another one that we've done is looking at population health. First of all, how do you even define population health? Is it assessing risk? Is it care management? Is it exchanging information? How do you define that by region? And once defined, who are the vendors or the suppliers that providers are choosing to implement these changes? So these are some of the pieces that we'll go look at. This is another big one, interoperability. And in 2010, there was something in the United States that happened. Obama wanted to stimulate the US economy, and so they came up with this phrase called meaningful use. I'm sure some of you have heard of that. This is where physicians in the US, hospitals, health systems, if they could become meaningful users of an EMR, they were given government money. And if they didn't, they faced penalties over time in terms of reimbursement. And one of the requirements in 2010 for meaningful use 1 was exchanging data with a disparate system, somebody outside of your four walls as a health system. And there was this whole advent of technology called Health Information Exchange, HIEs, that helped you to do that. And what was interesting is I helped author that first report. This was kind of the sale from the supplier, if you recognize The Wizard of Oz, right? Get this technology, you'll be able to exchange with other health systems in your geography, and it flows seamlessly, and you can identify patients, and there are standards in place. But what we found was this was really the delivery. There was a lot more to that if you're familiar with the movie. And so as we went out, we've seen this as a big challenge. And at class, we decided, well, we know all of the vendor executives. We're pretty good friends with most of them because we report to them what their customers are telling us as they participate with us. And so if you'll see in this picture, this was a summit that we held in Utah up at Park City in the mountains at Ski Resort. And we were able to invite, if you look at this picture from the left, that's Carl Dvorak, the president of Epic. Next to Carl is Zane Burke, the president of Cerner. Rusty Franz, president of NextGen, a big GP vendor in the United States. Girish Kumar, president of eClinicalWorks. Jonathan Bush, the president of Athena, another GP vendor. And then lastly, a woman named Hoda Syed Friel from Meditech. So, what's interesting about this picture is it was fairly candid, but you notice these people, these are vicious competitors of one another, but they're all smiling in this picture. They have their arms around each other, and they convened because class was saying, look, let's come together and let's figure out how we can be more interoperable as a nation. And you guys are the vendors that have the data, so you need to work together on how to do this. And from this summit, we were able to come up. We couldn't force this to happen at class or organization, but what we could do is we could say, let's determine the questions we ought to measure you on by going out and speaking with your customers about how interoperable you are or are not. And from that, we were able to put a survey together that we went out and conducted over 500 interviews. And we've now done this year after year, and we're starting to see a growing benchmark. And consequently, this is something we're going to be doing with NHS, in conjunction with NHS and NHS Digital in England, starting this week, doing the same thing with Trust in England, which is pretty exciting. But as we did this, here was some of the things that we found quickly, and I'll wrap up with this. And forgive me, we used a baseball analogy, but this whole notion of first base, second base, third base, and a home run, you'll see the criteria on the bottom. First of all, we asked, is the information received from the outside of your organization readily available? And we found that only 28% of the cases was that the case. Second base, was the information received outside the organization easy to find? Only in 13% of cases was it first and second base. And then it builds. Workflow, only 8%. And then home plate, in terms of the impact, was the information received from the outside organization significantly benefiting patient care? And you'll see that only 6% of cases of those providers that we interviewed in the US could say that. So we've got a long way to go. The nice thing is, the vendors were part of this. They said, yes, let's measure this. Let's get a baseline of where we are individually and where we need to go collectively. And this is kind of an interesting chart you'll see. Not a lot of differentiation by vendor. You will note that one particular vendor is quite good. Epic has a product called Care Everywhere. It's very, very good. If you're on Epic in the United States and somebody else is on Epic, you can pretty seamlessly share information through that medium. And you can see that from that the taller chart in the middle for Epic. But all of the other indicators we looked at of exchange partners using different EMR vendors all kind of compressed toward the middle. So there's great opportunity to improve interoperability. And this is something that has been very successful at creating a baseline in the US. And like I said, something that we're starting to expand in other geographies like England. And it'll be very exciting to see how the different suppliers that we're watching in England do under this scrutiny as well. And again, going back to my previous point, when you measure this, performance improves. But when you measure it and you put it out and shine a light on it and hold vendors accountable, the improvement accelerates. And that's really what our mission is about at Class, is helping providers be successful in implementing this technology. And with that, I will end. I will be speaking a little bit later at the CIO group this afternoon. I really appreciate you letting me come speak with you this afternoon. Thanks.